What would you do if you should encounter somebody who's having a seizure or someone who doesn't have a seizure? Hopefully by the end of the speech, you'll have a better understanding of seizures, of people who have seizures, and what to do when they have seizures. The purpose of I feel qualified to talk to you about this because my son has had a seizure disorder for the past 24 years, and due to the experience that I've acquired and the research that I've completed due to his disorder. The purpose of my speech is to expand your knowledge by giving you information about seizures and seizure disorders and what to do should you encounter someone who is having a seizure. Today I would like to talk to you about epileptic and pseudo-seizures and first aid procedures you should follow. An epileptic seizure occurs when there is abnormal electrical activity in the brain. The brain becomes disturbed by strange sensations, emotions, and behaviors. And some seizures go virtually unnoticed. In severe cases, it can produce a change in consciousness or loss of consciousness, involuntary body movements like muscle spasms or convulsions. Usually seizures come on suddenly and vary in duration and severity, but in some cases the seizure patient can experience an aura. An aura commonly occurs before the onset of a seizure. It is a signal that a seizure is about to begin. Auras affect the senses such as taste, smell, hearing, vision, touch, and even a sense of deja vu can occur. There are common triggers for a seizure that can trigger a seizure, such as missing a dose of seizure medication, nutrition, hormone levels, glucose levels, stress, flashing lights, and drug abuse. Seizures, a seizure may be a one-time event, or you may have recurring seizures. A recurring seizure is called epilepsy. According to Epilepsy Foundation of Kentuckiana, 1 in every 10 Americans will have a seizure in their life. Usually, though, they don't develop epilepsy. Often, the cause of the seizure is unknown. Typically, it's due to epilepsy or a physical problem in the brain structure or the neurons operating within the brain. While there is no cure for epilepsy, the seizure can be controlled with medication, diet, devices, and/or surgery. Sometimes, however, a seizure is difficult to find the cause of, and they are diagnosed with pseudo-seizures. Pseudo-seizures is a non-epileptic or psychogenic seizure. According to epilepsy.com, 20% of the patients who seek treatment for seizures have pseudo-seizures. People who experience pseudo-seizures, they have grandma-like twitching or jerking, aggressive behavior, abnormal behavior, and they lose consciousness. It can be as debilitating as an epileptic seizure. Pseudo-seizures have an entirely different cause than epileptic seizures and also a different treatment option. They are a manifestation of a traumatic event or an emotional disturbance. Unlike the seizures caused by epilepsy, that are caused by an electrical disturbance in the brain, they're caused by an emotional disturbance or traumatic event that the patient has had and suppressed it. It's the body's way of responding to an emotional or traumatic event that they have had, and it's the body's way of responding to it. Those that think that pseudo-seizures are fake should know that it is a stress-related complication, that it is actually a medical event that requires medical treatment. Through psychotherapeutic treatment combined with anticonvulsant medications supported with counseling is an effective way for controlling pseudo-seizures. Some individuals with this disorder, they have both epileptic and pseudo-seizures. Finally, I would like to talk to you about first aid procedures during seizure. According to Epilepsy Society, these are the steps that you should take. Although it can be frightening, remain calm. Take note of the time. Watch your time. If they have prolapsed, cushion their head. Move all sharp objects and things that might hurt them out of the way. Don't hold them down. Don't put anything in their mouth. Gently roll them to the side so that any secretions they might have will drain, do not block their airway. If it is a staring or blank, non-responsive seizure, gently guide them away from danger. Speak calmly and quietly. Again, note the time. If the seizure has lasted longer than 5 minutes, call an ambulance. If once the seizure has stopped, check their mouth and their airway to make sure that there's no food or false teeth that are blocking their airway. Call an ambulance if the breathing is difficult, if they've injured themselves during the seizure, or they have another seizure before they're fully recovering from the first. Stay with them until they fully recover or an ambulance has arrived. In conclusion, I would like to remind you that the purpose of my speech was to inform you about seizures and first aid procedures. I discussed about epileptic seizures and pseudo-seizures and the first aid procedures that you should follow. I feel qualified to speak to you about this because of the research and experience I have over the last 24 years due to my son's seizure disorder. Hopefully you have acquired a new understanding of people who have seizures and what to do if you should encounter someone who is having a seizure, and possibly save someone's life with the knowledge and experience that I have shared with you. I leave you with a famous quote of Theodore Roosevelt: do what you can with what you have, where you are. Thank you.